births as of 2006. That's the latest data from the Family Planning and Health Survey in the Philippines. And the Millennium Development Goal to reach in 2015 is 52. So even though there's been a significant decrease of 22% for the past 6 years since the survey was taken, it's still really far from the 75% that's the goal of the MDG. And according even to the government agency, the National Economic and Development Authority, that maternal mortality is least likely to be achieved by 2015. And according to the Department of Health in the Philippines, 47% of complications occur during the course of labor, delivery, and puerperium. And complications during the antenatal period are very related to the place of delivery and the choice of delivery attendant. Also, according to the National Demographics and Health Survey, in the Philippines, 44% of mothers give birth in a health facility, either a hospital or a lying-in clinic, while on a staggering 56% still give birth at home. And 36% of all deliveries are attended by a traditional birth attendant, or what we call in the Philippines as hilot. Okay, so this way you know that problematic maternal health care situations could possibly be because health services are not accessible. There may be in far-flung areas separated by mountains, or maybe in conflict-ridden provinces. However, based on statistics, maternal mortality also appears to be problematic in an area where health services are physically accessible and are very available. So this is the Philippines. Yeah, it looks like an inverted Y. Then this is the National Capital Region, where the city of study was there. And you'll see that Pasig City is in this area of the National Capital Region. It's located on the right side, near the province of Rizal. Pasig City is actually one of the central business districts in the Philippines. It has skyscrapers and really nice night view. And however, it's also it has also a lot of urban poor areas. And one of these urban poor areas is our barangay, or our community of study. Just to get things in context better, Pasig City is divided into 2 districts with 30 barangays with a population of around 600,000 people, while 65.4% are classified as urban poor, despite a lot of the several business companies hosting their offices there in Pasig, and very accessible healthcare facilities. Those numbers have changed according to later, but given that, there's still a lot already. However, the maternal mortality situation has been worsening since 2004, from 30 in 2004 to 130 in 2006 to 370 per 100,000 live births in 2008, according to the Field Health Information System. Okay, so more closely, we studied Barangay Pinagbuhatan. Barangay is the smallest political unit in the Philippines. It's the largest and most populated barangay in Pasig, with 105,000 population, with several maternal health clinics and health facilities, and really accessible prices for healthcare. Just to get things in context, $1 is around 40 pesos. So it's really accessible for a lot, and a lot of the services are free. So the main research question of our thesis was to investigate the significant factors that affect the utilization of maternal healthcare services based on the health belief model. The primary objective was first to describe the utilization patterns of women in Barangay Pinagbuhatan of maternal healthcare services, and to determine the factors that are associated with its utilization. So the health belief model is the model that we use. It's composed of several constructs that evaluate individual perceptions and to predict the likelihood of actions for healthcare behavior. The HBM has been used for many other studies, such as mammogram test and contraceptive use. Also, just to explain our methods, we had an eligibility criteria. We interviewed mothers who have given birth within the last 2 years. We obtained a list from the community health center. And of course, no one was forced to participate in the study. We did a simple random sampling with the following statistical measurements, used SPSS, and sampled according to our literature. We found we needed to interview 246 women, but we interviewed 300 for the sake of completion. We sampled 22 times because a lot of mothers were rejected being interviewed. Okay, so data was collected through an interview-guided questionnaire, and the study variables are the dependent variables are the maternal health care utilization variables, which includes prenatal care, or the number of times the person visited during prenatal visits, antenatal care, which is the number of required tests or exams that were taken or medications, postnatal care, if the mother went to a postnatal checkup after pregnancy, the choice of delivery place and delivery attendant. And the factors that we investigated, or the independent variables, included factors of the health belief model, which included perceived benefits of the healthcare provided, internal factors, or the level of confidence mothers have on themselves, demographic factors including age, social status, level of education, income, and the like. Perceived severity, this is about the perception of the mother on how severe pregnancy complications are and how it can affect her baby, and her life. Perceived barriers are perceived physical or social barriers that impede the utilization of healthcare. Of course, healthcare provider factors are the perception, the trust on the healthcare providers, and cues to action. Cues to actions in our study included appointment reminders, posters, community organizations that influence the utilization of healthcare. So questionnaire design was we did just a survey with usually the perceptions were measured through a 4-point Likert scale, depending on the level of agreement. So we had to translate our survey to Filipino. So going to the results, we used multiple regression as the analysis of choice to determine the relationship of the health belief model factors. Okay, so the sampled population had a mean age of around 28 years old. They were predominantly high school graduates, mostly middle to low income. The first three middle to low income. Most were in their second to third pregnancies. They were mostly married or living together with a partner, and mostly were housewives and or unemployed. Also, here are the patterns of maternal health care use in Barangay Pinagbuhatan. So 69% availed of 4 or more prenatal checkups, which is the recommended adequate number for normal pregnancies. Most of the required tests and procedures were complied with by the mothers. However, only a few had internal exams, had their height checked, or consistently took folic acid. For the delivery attendant, 31.3% were attended by a physician, 52.4% were midwife assisted, 0.4% were assisted by a nurse, and a significant 16% were assisted by a traditional birth attendant. For the place of delivery, 42.3% were still done at home, despite all those accessible healthcare facilities. 28.9% were done in hospitals, and 27.2% were done in midwife-run, lying-in clinics. There are clinics for normal births, and 1.6 or 2 people gave birth on the street because they weren't able to reach the hospital. So for postnatal checkup, only around 39% went back for a postnatal checkup after their pregnancy. So during doing a multiple logistic regression, we found out that older women are 10% more likely to have an adequate prenatal checkup. However, an increase in the number of pregnancy decreases the odds of mothers availing of adequate prenatal checkups. For prenatal medicines and medications and tests, a similar pattern is evident with prenatal tests. However, there's also a significant contribution from cues to action, which include appointment reminders, posters, or community events that promoted the utilization of maternal health care services. So more importantly, we focused on delivery care. And since the perception that was, the construct that appeared significant in our study was perceived severity, it was significant for both the utilization of a healthcare facility in giving birth and the choice of a medical professional in giving birth. Mothers who thought that pregnancy complications were severe were more likely to choose to deliver at a health facility with the assistance of a healthcare professional. It has been found in several studies that the failure to recognize symptoms as severe was also a major reason for the delay in seeking care or professional advice. Perception of severity of pregnancy complications refer to the seriousness of pregnancy conditions and its possible complications. And that, also, it measured how mothers thought it could affect their lives, their children, and their family as well. Encouraging midwives to advise delivery in a health facility has been proven effective in many instances according to literature when midwives refuse to deliver babies at home, especially because it exposes mothers to a lot of risks and unforeseen complications which may not be treated when mothers give birth at home. And going back to demographic factors, older women, a married status, an employed status, a higher educational level, and having experienced more pregnancies increase the likelihood of mothers in choosing a health facility setting, while older women, a married status, and having experienced more pregnancies were significant in increasing the likelihood of mothers to choose a healthcare provider during delivery. Lastly, in postnatal care, the only significant perception was on the cues to action, health posters on its effect on mothers availing of postnatal care after their pregnancy. Also, some recommendations that we did, that we proposed to the city when we presented our thesis to them, was number one, to increase the cues to action for prenatal and postnatal care, especially partnering with high schools or colleges that could do promotional activities, non-traditional, not just posters, not just traditional promotional activities, even sometimes inviting famous actors or actresses to advocate for maternal health, especially since it's been effective in literature and in some of the other projects we did in school and in delivery care, since the traditional birth attendants are still very evident, very trusted by the community because of how they take care of the mothers and how they appear to be more caring and less cold compared to the professionals in the community healthcare center. There have been recommendations to include them in the healthcare system by advising them to refer their patients or their clients to professionals with a referral fee so that they won't necessarily lose their income. And of course, there have been suggestions on training traditional birth attendants, but there have been other problems that has made. And of course, the stricter implementations on the ban on home deliveries, especially in areas like Barangay Pinagbuhatan. So this is our thesis group. We were 7 and we're all we just graduated recently from our undergraduate. And we all want to thank you for listening for our presentation. So good job. Send that to me. And if you want to questions, thank you.